Me now is Lisa Morgan, president of Georgia Association of Educators. Lisa, thanks so much for taking the time this morning.
Thank you for having me.
You've seen the numbers as some schools go back to in-person learning. While they remain small percentages, you are seeing it spread among the student body and to some staff. Do you believe that teachers would be risking too much to return to in-person schooling?
I have heard the words from educators scared to death multiple times over the past month or so. We have educators who have pre-existing conditions themselves. We have educators who have family members with pre-existing conditions, who have very young children, who care for elderly parents or grandparents. We are asking teachers to risk their lives daily to a virus that is preventable, that we can control the transmission, and the measures that are being put in place are not measures that we know will prevent the transmission in our school buildings.
I wonder if you feel differently about counties and cities that have managed to control the outbreak and keep infection rates low, below markers that the CDC establishes. I mean, even Dr. Fauci has said that areas with low infection rates, they can go back to school safely with mitigation. Would you support teachers and students going back to school for in-person instruction where those rates are low?
Where those rates are low and where the schools are providing the resources necessary to include all the mitigation factors that the CDC is recommending. For example, the guidelines say 6 feet of distance, and we know that is not possible in a classroom with 25 to 35 students. However, physical barriers, if the school is going to put those into place to mitigate that risk. None of the schools here in Georgia are mandating masks. Very few of the school systems are. They are strongly suggesting. So we know the mask is a mitigation factor that is necessary to keep people safe. So our schools need the resources and the policies to ensure the safety of staff and students.
Are you seeing that happen anywhere? Are you seeing any school districts that are managing to take those steps so that they can meet the standards and get teachers and kids back into the classroom?
We do have some school systems that are doing hybrid models, which is reducing the number of students in the classroom so they can socially distance. And we do have school systems where masks are mandatory. And we've heard from some teachers in those systems that they do feel safe. But it is an issue that the infection rate across the state of Georgia remains very high, and that the number of children with coronavirus more than tripled from July 1st until now, and that's with most children not in school.
That's a thing, you know, whether for schools or businesses, if you get it under control, that lays the groundwork for reopening. Kristen McConnell, she's an ICU nurse in New York, and her husband's actually a public school teacher. She wrote an op-ed in The Atlantic calling for teachers to come back to classrooms. I want to quote from it and just get your reaction. She wrote, "Schools are essential to the functioning of our society, and that makes teachers essential workers. They should rise to the occasion, even if it makes them nervous, just like healthcare workers have. Teachers signed up to be a positive adult presence in children's lives, help them grow up with their peers at school, away from home. We need them to follow through." I wonder what your reaction is to that challenge there. Do you think teachers should approach this similarly to the way healthcare workers have?
I think teachers have rose to the occasion every time we've been asked when the risk was to ourselves. Teachers throw themselves in front of bullets when there's an active shooter in the building. But this time we are being asked to potentially sacrifice not ourselves, but also our family. And that is the difference. I've read from educators who have told family members, I will not be seeing you because I cannot put you.
Right.
The emotional impact to a student, yes, our students need social interaction, but nobody's asking what is going to be the impact on that student when their teacher or a classmate becomes ill because they were in the building together. This is not a simple solution of, oh, we just go in and everything's going to be okay. We know it is not.
Well, listen, we do wish you the best of luck. Your fellow teachers and the students there in Georgia. We hope you find a way. Lisa Morgan, thanks for coming on.
Thank you.